today, ASM. We're talking with Jacqueline Schuller from Sharp. Jacqueline, thank you so much for taking the time.
Absolutely, thank you.
So, talk to us a little bit about what are some of the largest issues or challenges that hygienists are facing today within their practices?
Sure, absolutely. I think there's two of the largest issues that we see are, number one, the rising instrument costs currently in the marketplace, and number two, that a lot of practices do not have any instrument placement or instrument programs in place. So with regards to rising instrument costs, if you're buying typical scalers and curettes, you need to efficiently run a practice in one operatory, you need to go through about 30 instruments a day. So that is about 5 sets of 6 instruments each. Changing them out 3 to 4 times a year gets really pricey, really cost. And then a lot of these offices, they really don't know what their spend is and what they're doing, and they don't really have a budget in place to provide quality new instruments to their hygienists to use for on their patients.
And can you tell us, what is the OIM program?
The OIM program is an operatory instrument management program, and what it does is it's going to provide the practices with ways to better manage their instruments, reduce their costs, and it ensures that hygienists are going to have clean, new, high-quality instrumentation to use on each of their patients. So what happens is a hygienist will come and say that she uses these specific 6 instruments within her operatory. So they will get 5 sets of 6 of those specific 6 instruments that are currently used. They get them in the mail, open them up, they're sterilized and they're ready for use. At 4 months, they get a whole new set of instrumentation. They package up the instrumentation that they've used, send it back, and then they have brand new instruments to use for 4 months, and then it continues to cycle through. So what happens is the practice pays monthly, and then they continue to receive those instruments every 4 months. And the instruments, every time when they come back to us, they're either retipped, replaced, they're professionally sharpened by the actual people that are manufacturing them, so they're getting brand new instruments each time. So again, what happens is they're able to provide excellent patient care and utilizing the new instruments on their patients, and at the same time, the practice knows how much their spend is every month, per year on the instrumentation.
So to summarize, what would you say are the chief benefits or advantages of the OIM program?
Number one, you have a budget in place for your instruments, where a lot of practices right now don't have it. They have no idea what they're spending. It's ensuring that the hygienists are, again, having the high quality, sharpened, brand new instrumentation to use day in and day out on their patients. So the patient, or the level of high quality patient care is increased. And again, also the doctor reaps some benefits as well. So for every hygienist that's on the program, the practice receives 10% off of all of their instrument or suture needs throughout the practice as well. So that's a little added benefit for the doctor as well.
Super. And if our viewers want to learn more about the OIM program, what's the best way for them to do that?
Well, what they can do is they can go right onto our website and at dsharp.ca, and it has a whole PDF information. You can actually reach out to our customer service team, and they'd be happy to help walk through the program with you, customize it to your practice needs, and they can go from there.
Hi, my name is Kim Valenti, and I spent 12 years as a practice coordinator in the dental setting. After coming to work for Sharp and implementing the OIM program into several offices, we've realized that it helps to solve a couple problems that offices face. The number one problem would be setting and maintaining a budget for hygiene instrumentation. The OIM program allows you to not only maintain a low monthly budget, but it also allows you to keep high quality new instruments in the hands of every hygienist on a regular basis. The second solution that the OIM program provides is by maintaining and providing high quality instrumentation. It allows less chair time for the patient, helps you run a more efficient schedule, it increases patient experience, it keeps them coming back time and time again, it helps to organize all the things that a practice needs. So in conclusion, the OIM program is a great benefit for any office looking to organize, be more efficient, stay on a budget, anything that an office could need. I couldn't say more, it's a great program.